computer. So, Dr. Yipeng Ge, thank you so much for joining me today for a few minutes to share your recent experiences.
Thank you so much for having me.
You are one of the few Canadians who got to go to Gaza recently and spend a little bit of time up there. You go in your capacity as a medical doctor. First, how do you get to Rafah?
I was able to get to Rafa as a medical volunteer through GLIA International and Humanity Auxilium. These are both organizations that are based and mostly in part run by Canadians. So I was in touch with both organizations to enter Rafa as a medical volunteer through the coordination of the World Health Organization.
And so to get there, you have to land in Cairo, and then you go to the border. Once you get across the border, what do you see on the way in to the border?
It's quite the journey to get to the border to begin with. We started with a United Nations convoy from Cairo to Rafah border, and it took about 8-9 hours for us to make that journey through the multiple Egyptian checkpoints along the way to get documents checked and sometimes bags checked. Once we were approaching a few kilometers, actually maybe even many more, like tens of kilometers away from the Rafah border, you already see these trucks lined up, some of them parked along the side of the road, like even just beyond the side of the road, but along the whole way to get to the border. All those stretches of road are just lined with aid trucks that are waiting to get in. And we have satellite images that show, I think it's over 2,000 trucks that are being held up in part by the Egyptian government, probably in part by the Israeli government, so that these essential, medications, supplies, food, water, fuel aid can't get into to support the people in Gaza.
So you pass this, you cross to presume some kind of checkpoint, and you're inside Rafah. Then where do you go? What do you do?
Once we were in, we were picked up by ambulances to the hospital that we stayed at for that one evening, and then later on we stayed at a different clinic for the most of our time there, a primary care clinic. So we were able to work out of that clinic and also stay there overnight, and also work in other locations, including another smaller primary care clinic.
And what kind of work were you doing? You working like an emergency room doctor? You're doing operations? What are you doing?
No, so I'm not a surgeon, but I have been trained in emergency rooms in Canada with my primary care training. We were initially tasked, to actually go to Nasser Hospital in the days leading into our entry into Rafah, but that assignment entirely changed because of the security and also access restrictions to Nasser Hospital. And we know what's happened even in the course of our time there. The ground invasion that took place, people were evacuated at gunpoint. Patients were evacuated at gunpoint. And we primarily worked out of 2 primary care clinics, both based in Rafah, and provided primary care services, but it essentially kind of functioned more or less as almost like a pediatric emergency room based off of the cases that I saw. Most of the cases were children, and most of them are quite sick with bacterial pneumonia infections, wound infections, severe burn injuries that we wouldn't have even expected. We hear about burn injuries from shelling, from airstrikes, but there are also a lot of domestic burn injuries because people do not have secure housing or access to a stove. So people are heating water, cooking food, the limited amounts of food that they have with fire and wood. And these are causing severe burn injuries as well. A lot of the cases that we saw were gastrointestinal illnesses and diseases, including a severe hepatitis A outbreak. And among all that, it seems like everyone is malnourished. One of the most sickest children I've ever seen in my career, I met in Gaza, was someone who was 8 or 9 or 10 years old, being carried in by their mother and was kind of on the brink of death because of acute on chronic malnutrition. They had some kind of gastrointestinal infection, wasn't able to eat for 4 days. But even before then, they weren't walking because of how malnourished they were.
Were you personally with bombing going around you, with roofs caving in, soldiers shooting at you? What was your personal situation? How much danger did you personally feel? Or maybe you're too busy to notice.
You certainly are reminded of the danger almost on an hourly, if not minute by minute basis, because of the overhead drones that you can hear. Sometimes they get this louder buzzing because they're a lot closer to the ground. And throughout our time there, we actually heard and felt an escalation of the bombing and shelling, particularly in the evenings around the clinic. There was one day I was at the clinic on the phone with the Canadian counterpart, and actually there were multiple bombs heard around my vicinity. I asked them, "Did you hear that?" And the north part of the clinic actually shook. But it was so striking that even the other folks around were not disturbed by what they had felt, because it's just so commonplace. Another example was we were at the home of a doctor and their kids, and a missile landed very close to this building, and the building and the glass panes also shook. We were caught completely off guard in the middle of our sentence. Even just the whistle of the missile, kind of like, even before the explosion, you worry that maybe this is the end.
This is it.
Oh, like this is it. And the family with children as young as 4 or 5 years old, they didn't flinch at all, because it's been made completely normal. Unfortunately.
I've seen, and I think anyone who follows this at all has seen many pictures of kids whose arms or legs have been amputated, terrible burn injuries, pictures of kids starving. And I'm sure you were in the midst of that, but what struck me in your series of Twitter pictures were happy faces. People happy to see you, mothers coming in with their kids. If I hadn't known if I hadn't read the text and just looked at the pictures, it would have kind of been like a friendly visit to Gaza. So tell me your thoughts on that a little bit. I'm not criticizing the pictures. I'm just saying it was interesting to see it from that light.
I think it was a very purposeful framing on my part to recognize first the humanity and the compassion and the resilience of the Palestinian people that we met in Gaza. The generosity and the joy that they have in receiving us as international physicians is something that I will remember for the rest of my life. Despite everything that they're going through and the things that I've shared, and the things that we've seen come from the ground for months now, despite all that, they choose to share community, share food and water with us, have such, create such space for joy and happiness, and try to actually give their children a more or less, good life growing up, despite all the challenges. I think the burden that the adults carry is something that I cannot ever fully imagine. I do not have children of my own. And so many of them that we spoke to, many of whom were the healthcare workers that we worked with, they hold their children at night, worried about seeing the next day. Still trying to create, a condition for these kids to have joy, the number of times I actually saw children outside flying kites or preparing to fly a kite was incredibly symbolic and moving, as I thought about Rifat's poem about the kite, and also about how I don't remember the last time I flew a kite. It was in childhood. It was in when I was a kid, and the amount of joy that you have, and recognizing joy as resistance, recognizing smiling and laughing as resistance. Like the best quote unquote revenge you can have to something like an ongoing genocide is to live the best life that you can despite the circumstances. So I think that is why I shared some of those initial photos that I did. But I think we also need to recognize this is not normal to have such resilience, to have such adversity in the face of what is the unimaginable for so many in this world. This is completely unacceptable to have to continuously try to humanize people that systematically have been dehumanized by Western nations and society through anti-Palestinian racism. And so moving forward, yes, we need to acknowledge the suffering. Yes, we need to acknowledge the atrocities, the human rights abuses, the war crimes that are taking place through forced starvation, through attacks on healthcare, attacks on civilian life. But we also need to recognize the resilience, we recognize the adversity, but recognize that all of this is preventable and should not even be allowed to happen in the first place. But I think getting that kind of framing right is always a challenge. As someone who has primarily worked in the Canadian context in Indigenous health and decolonizing Canadian healthcare, is how do I, as an ally, acknowledge both the struggle and the resilience of people that experience structural oppression and violence. Because what they're going through is a genocide. What has happened in Canada is an ongoing genocide of Indigenous peoples. And how do we recognize these multiple sides of that coin, of that of suffering and of perseverance and resilience?
Dr. Ge, would you go back again if you had the opportunity?
Most certainly.
Well, thank you for bringing us a little insight into your experience, their humanity, and yours. My hat's off to you. And I know that you've also faced some pushback in Canada in your attempts to talk about and bring to Canadians' attention the serious situation in Gaza, and we'll be following that going forward as well. Thank you so much, Dr. Ge. Have a good day, and look forward to having another opportunity to talk to you.
Thank you so much.